Good afternoon, everyone. I want to begin by acknowledging that we are gathered here today on the traditional territories of Treaty 6. And we recognize the Métis people who share a deep connection with this land. My name is Mike Parker, and I'm the president of the Health Sciences Association of Alberta. And joining me is Vice President Liana Farrow, as well as the board of directors of HSAA. Together, we represent more than 30,000 highly specialized healthcare professionals across this province. The members covered by this collective agreement are employed by Alberta Health Services and other provincial agencies and corporations, including Acute Care Alberta, Recovery Alberta, Primary Care Alberta, Assisted Living Alberta, Cancer Care Alberta, Emergency Health Services, Lamont Healthcare Centre, and the Bethany Nursing Home of Camrose. These are your paramedics and your MRI technologists, your mental health and your addictions counselors, your social workers, respiratory therapists, pharmacists, speech and language pathology, dietitians, physiotherapists, and hundreds more. And every day, they are there for Albertans from the first call for help through diagnosis, treatment, and recovery. Our members care for Albertans in hospitals, in health centers, and in communities in every corner of this province. Recently, these critical frontline professionals were presented with a new tentative agreement. They were asked to vote on that agreement starting on August 28th, and that vote ended at noon today. We saw record turnout for this vote. 78% of our members cast their ballots. And for the first time, our members have rejected this tentative agreement at our largest bargaining table. A majority of 59% voted no. Today, HSA members are sending a clear message. They are rejecting a deal that does not support them enough. This decision of our members reflects the truth of what Albertans are experiencing in healthcare right now. Our health workforce is under immense strain. We face a dangerous shortage of healthcare professionals in our province. A shortage that is felt by every Albertan who endures longer response times, longer wait times in emergency rooms, delayed surgeries, therapies, and the prolonged agony of waiting, often for months. Our members are living these challenges with Albertans each and every day. They care so deeply for their patients, but that care now comes with an unmanageable cost to all of our members: short staffing and no work-life balance. Burnout's becoming routine, pushing more people out of these professions. The numbers tell the story. 89% of our members say the system is in crisis. 80% say that short staffing is harming their own health and well-being. 67% of our members report inadequate staffing levels. 63% of our members are already burnt out. And a full 1/3 say that they are thinking of leaving Alberta, or worse, leaving healthcare entirely. Our members are healthcare in this province, and Alberta simply cannot afford to lose them. Without us, this system doesn't work. And the more professionals we lose, the bigger the gaps in our care, and the more Albertans who fall through the cracks. Our members are asking for wages that respect the work that our members do every single day. And that allows us to attract more colleagues to the front lines so that we can continue to provide the care that all Albertans deserve. This agreement was rejected today simply doesn't do enough to get us there. In a time of global staffing shortages, when every other jurisdiction is doing more to keep and attract workers, we need to ask ourselves, is this going to be Alberta that leads the way? Will we invest in healthcare dollars where we know it's going to work? Our people who provide the frontline care for all Albertans. Now, I want to be clear. Our union is not calling for a strike vote at this time. Today, we are calling Albertans, Alberta Health Services and the government of Alberta to bring forward a deal that will improve wage offers. We still believe we can reach a fair agreement that truly reflects the life-changing care of all of our members and the reality of the pressures that they face every day. But we need a commitment from government to invest in the people who make care possible. We'll be engaging with our members to support our next steps. And we know HSA members are ready to show their solidarity and ready to stand up for themselves. Thank you. I'd be pleased to take your questions.
Hi, Cindy Tran with the Edmonton Journal. I'm wondering why you're choosing not to take strike votes today.
This is a decision of our organization to reach out, connect with our membership, and ensure the path forward. And by talking with our members to understand where we are at this point and discuss with them what steps we will take going forward. There's no rush here. We're hoping they come back to the table. We're preparing for the next steps with our membership.
So today, Minister Horner had said it is now up to the union to determine why the ratification vote failed regarding their own proposed deal. I'm wondering what you make of that statement.
Yeah, that's interesting. The minister is very aware of the shortcomings of this wage offer. To be clear, we spoke to them directly. They know what's going on here. We hope the government of Alberta and Alberta Health Services realizes that our work over the last 16 months to explain to them the shortcomings will now reflect the work that they bring back to us to conclude a deal.
Is there a number?
No.
James Dunn, City News. Are you able to shed light as to what was in the deal that was turned down? Like, there was, obviously talk of wages would be the big issue. What was the number that was agreed upon the first time?
So as far as the numbers go, they're going to vary. It depends how we work forward in this path, in this conversation, but I'll be crystal clear. There's not enough in this deal. There's not enough money. And if this government wants to see a ratified deal, they better go work on a new mandate.
We just saw, obviously it's been a couple weeks for unions in general. AUPE got a deal, tentative. Teachers were given strike notice today. I guess, where do you lie as to the state of maybe healthcare unions and unions in general in Alberta?
I would suggest that it's the labor movement in this province. We haven't seen upheaval like this in a generation. So there's a cause here, and it isn't us. We're trying to get back to the bargaining table. We need a fair deal. Our members have made it crystal clear. And if you want to know where the deal lies, maybe we need to go ask the government.
How far are you willing to go to get what you want? You said you're not having a strike vote yet, but
correct.
How close are we to that happening?
I would suggest it is an opportunity that remains on the table for us to consider. Our board of directors is here discussing that exact action now. That's why they're here. And we will work through the plans that is support our members, and that's the direction we're going to go.
Isn't the rejection enough for to think about a strike vote?
I think it's clear to say this, that this union has never had a vote like this that's rejected a tentative agreement. We have never seen numbers like this from members that voted on this agreement. 78% of our members cast their ballot and they rejected this deal. That is clear. How we move forward is the next discussion.
So I know you're talking about it, but what's the plan right now? Like, if the province is not going to move, how long are you willing to wait on that?
As long as it takes for our folks. We're going to talk to our members. We're going to build our plans with our team. Again, this is pretty new. Our union has to look at this for the first time and realize what we're going to do next. The reality is, though, is that not only does this group of 22,000 face this conversation, our folks at Alberta Precision Labs, our folks at Covenant Health, and other multiple contracts are all out there trying to get a deal. And this government seems to be tripping up because the information that they have brought is not accurate to what our members are feeling every single day on the front lines.
Obviously, this is just one collective agreement. What's the state on others?
At the moment, the others are being, I would suggest, delayed by the employer side while this table moves through the process, which is disappointing because we all deserve a fair collective agreement. And I would suggest the government needs to recognize that and get everybody back and get them a deal they deserve.